Hi guys, this is the part 2 video of the contrast bath. We already saw what is contrast bath and what are the physiological effects, principles used in the contrast bath. Now in this video, we are going to see about what is contrast bath therapy and what are the essential equipments we are used in the contrast bath therapy. As I already said that in this contrast bath, we use two vessels or two utensils or two buckets with one with the hot water and one another with the cold water. Two containers. Let us consider it as two containers. Two containers for one is for hot water and another one is for cold water. It may be a foot, hand, or forearm. It should not spill. So that wise, it should be a bigger one. First, two containers. You will need to separate large containers, each sufficiently sized to comfortably immerse the entire treatment area without spillage. Material can range us from plastics, plastic tubs to specialized hydrotherapy units. Hot water source of the hot water should be ranged from 38 to 44 degrees Celsius or 100 to 100 degree Fahrenheit. It's crucial not to exceed 44 degrees Celsius to prevent the thermal injury, especially in patients with compromised sensations like diabetic neuropathy and neuro patients. The cold water source must be it is cooled until it is 10 degree to 18 degrees Celsius or 50 to 65 degree Fahrenheit. Ice may be added to achieve and maintain the desired cold temperature throughout the treatment, particularly during longer treatment sessions. And the thermometer is must to check whether the hot and the cold is on the same ranges throughout the treatment sessions. A reliable thermometer is indispensable for precise monitoring of both hot and cold water temperatures throughout the entire duration of the therapy. This ensures consistency and prevents extreme temperature fluctuations that could be harmful for the patient with neurological deficits. The towel and chair should be used while it is not listed. Having towels nearby for drying the limb is necessary, and a comfortable chair for the patient to sit during the treatment. Also, practical considerations should be added with the treatment necessary things. Then, a detailed technique of treatment is initially we give hot water therapy and then we will give a cold water, like in a 4:1 ratio. If we use for 4 minutes of hot water, then we will go for 1 minute of cold water. The precise application technique is paramount to maximize the therapeutic benefits of contrast bath therapy while ensuring patient comfort and safety. Adherence to the recommended timings and sequence is crucial for eliciting the desired physiological response. Like I already said, if we give for a 4:1 ratio, the initial warm soak will be given for 10 minutes. Begin the treatment by immersing the affected limb in the warm water bath for an initial period of 10 minutes. During this phase, encourage the patient to perform gentle, pain-free range of motion of the uh, immersed limb. It helps to prepare the tissues and promote initial vasodilation. Alternating cycles for 4:1 ratio. After the initial warm soak, the alternating cycle commences the transfer the limb from the warm bath to the cold bath. Immerse in cold water for 1 minute. They immediately transfer back to the warm water for 4 minutes. This 4:1 warm to cold ratio is essential for the vascular pumping effect. Repetitions, we will give it for 3 cycles. We will give 4 minutes of hot water and 1 minute of cold water. We repeat it for 3 times. It is sufficient to stimulate the vascular system and it gives the consistent therapeutic action what we need. While we are winding up the treatment, we can go with the warm water. It may be optional. Generally, we use the conclusion with the warm water. Total duration on the post duration, it will take approximately 25 to 30 minutes. Post treatment, gently dry the treated area with the soft towel and we avoid vigorous rubbing. Why it may irritate the patient's skin. In the next video, we will see what are the next effects of the contrast bath. Thank you.